Right, and that story begins our conversation here with Senator Mithika Linturi, who is the Senator of Meru County. We have on the line Juan Mwakamore, who is the Deputy Majority Whip at the National Assembly. We also have Ruben Kigame, who is the convener at the Linda Katiba. We also have Dunstan Omari, who is an advocate of the High Court. And as we get into this, let's begin by looking at specifically the situation between... I mean, of course, you are looking at the numbers and they continue to rise. The month of April already, like I had said earlier, we are seeing that the positivity rate is at an average of about 16% plus. And there's an ongoing lockdown. There are several concerns from different businesses. Senator Linturi, what are your thoughts about the COVID-19, especially the battle against it, and where we are as a country on this front?
Thank you, Tom. I think... to begin with, I must admit that this virus is really brutal, and I think there is no doubt that Kenyans are facing very hard times, and I must condole with the families in this country that have lost and are continually losing their loved ones every day through deaths caused by COVID-19 complications. It is very painful, and what is even more serious is that you find that people have no hospital beds. When they get, or they are lucky, the kind of money that is being asked by hospitals for deposits or even for treatment of COVID complications is so exorbitant, it's so high, out of the reach, not even of the ordinary Kenyans. Even the average Kenyans cannot afford. And I think we will permanently live in this state of fundraising because we also have a very, very insensitive government which does not care, which does not feel the pain or even have an idea what the common man is going through. And I say this with a lot of respect because you realize that an institution like NHIF is the biggest, is supposed to be the social protection caregiver of the Kenyan citizens. It's the biggest national institution offering insurance for the Kenyan people. It's an institution where we contribute money to. And when NHIF does not pay bills occasioned by COVID, then you must understand how painful it is. When you have a government that knows the pain, or that should know the pain, I think, because that's the one that should use, should know what Kenyans are feeling. And we are not finding any budgetary allocations, whether in the supplementary estimates, supplementary budget, or even the budgets to come, either to support directly the people that are going through this kind of pain, or to give to NHIF to at least be able to share bills with the Kenyans, because this is a pandemic and people never expected it. Insurance companies are not paying. Then you realize that Kenyans are left to stand by themselves. It is very painful. I know what it means to have COVID-19 patients. I know the kind of abuse patients are forced to cough, because some, I can tell you, people are in pain. Kenya people are suffering, and this is the time we would have expected the executive to wake up and come up with measures to provide or look for money to assist Kenyans. Look, imagine a situation whereby you find Parliament or the executive proposes an increase of taxes. Right? You know that last year when COVID came in, the justification for the reduction of pay as you earn from 30% to 25% was to cushion Kenyans from the effects of COVID. The reduction of VAT from 16% to 14% was to cushion workers in this country, right, business people, from the effects of COVID. So when Parliament again reversed these to 30 and 16 and other taxes, then you feel to understand in what kind of a world these people live in. Because
even though, Senator, the argument that time was that the economy was beginning to look up, but also the challenge that government was facing in terms of revenue shortfall. So there was an attempt to recover that. But one, Ruben Kigame, I don't know what your thoughts are about the war against this pandemic so far. Of course, it has caused ravages across the country, fatalities reported on a daily basis. People have lost their livelihoods. What are you thinking at this point in time?
Two quick things. The first thing I'm thinking is when we say government, we often imagine that government is medical experts. By government, most of us are looking at politicians. We're looking at those in the different sectors of decision making. But we forget that these people are also affected. So government is not a species that is, from outer space. These are people who also are affected by the pandemic. So the problem that we are dealing with here is systemic because we are approaching a medical problem using political, eyes. And so at the end of the day, it's like asking the Air Force to do marine services. And that is where we're going wrong. Because this whole thing should be handed to medical experts. I would have loved personally to see KEMRI a bit more involved in guiding the government, because these are the research specialists that we are trained. I would have wanted to see epidemiologists taking over advice for the government, and local medical experts at that. I have more faith in local experts, medical experts, because they live here. They know our situation much, much more than even the WHO. And so where the government is going wrong, in my opinion, is that it's pretending to handle a problem they cannot handle. A medical problem should be given to medical experts. And the medical experts are not those the CSs in health and so on that come to make statements. These should be Kenyans that have spent years in research. Even decisions about whether we should take the vaccine or not should not be a prerogative of Uhuru Kenyatta or a Ruto or a Raila or any politician. We should be listening to the director of KEMRI. We should be listening to our own specialists here. And I think that's where we are getting it all wrong.
But Ruben, when the president comes out and says that the experts have advised that the best way out of this spike that you currently experience is to take a short break and sort of have the partial lockdown, isn't he warranted to make such a pronouncement based on what he says, advice from the experts?
He's not warranted. He's not warranted because who are these experts? Name them. I would rather hear Director of KEMRI making that report, the statements. I'd rather hear the medical experts explaining rather than leaving medical language and medical solutions to, non-medical people to tell us what to do. In fact, where we are at now, we are concentrating on the serious cases when actually the average person needs information about prevention, about what to do when COVID strikes. The figures are good, but they don't help anybody to know today this many people died. They have died. This many people got infected. They've been infected. The issue is, what will the average Kenyan do in the event that they feel these symptoms? That is what should fill the airwaves. And at the same time, what we should be looking at is, instead of the media, for example, giving us statistics about so how many we are at, in terms of how many have died and so on. I think we should get to the point where we are asking how many oximeters do we have? Instead of advising citizens to buy, thermal guns to check your temperature, which are not accurate. Because, for example, if you've been standing in the sun for too long, your temperature will read high.
Right.
But the most important thing would be an oximeter, which is able to tell how much oxygen there is in your system. And by the way, the last time I checked, an oximeter is cheaper than a thermogun. So the way we are handling this thing is like handling fire with newspapers. And so we need to completely shift our focus from political direction and, and Uhuru Kenyatta giving us direction.
Okay.
Let me just mention this. Maybe you don't know that in the zoned off region of 5 counties, you're in Nairobi, so you're affected. Are you aware, I guess the media reports are right when they say that you have only 58 ICU beds in the 5 counties. I mean, so instead of all these figures and you're trying to talk about COVID as if it's something we can solve next year with the elections, we should be asking ourselves, how can we increase these ICU beds and HDU ward spaces? That is what we should be worried about now. What happens, so that we don't have to wait for somebody to die for us to get an ICU bed.
Right. Ruben.
It is bad.
Okay. All right, Ruben, I need to cut you short because you just made a statement there that in the 5 disease-infected zone counties, we have 58 ICU beds. But the figures we have, this is according to the Kenya Medical Practitioners and Dentists Council, as of March 2021, the Kenyatta National Hospital had 86 ICU beds. Nairobi Hospital, which is a private institution, had 36. KU, Teaching, Research and Referral Hospital, had 32. Nairobi West Hospital had 46. That is Nairobi West Hospital. And MP Shah Hospital had 6. All these are within Nairobi County. So it's obviously above 58. But the same way, I can give you some time to verify your figures and then we get back on. But Honorable Mokamore, there's this complaints from different people. I want us to listen first to what the president said in as far as this lockdown. I don't know that you have that clip of the president speaking about why the lockdown will remain until we flatten the curve. Let's listen to the president.
These are measures that have been brought to us by those who have the knowledge, the professionals, the doctors, the medical practitioners, the scientists. They went through and we had long sessions with them. And this was their recommendation, that if we are to stem this virus from continuing to grow, kill people, the only thing we can do is to lock down. In fact, if we had gone by their extreme measures, they had wanted us to lock down the whole country. We had to come down to tell them, we also have an economy, we also have livelihoods. And we went for what is called a partial lockdown, not even a total lockdown. So all I can say is, fellow Kenyans, I know it is difficult, but we cannot pretend that this disease is not with us. We cannot ignore the advice that we are getting from the World Health Organization, from CDC Africa, from our own experts, that the only way to save lives is to take the measures that we have taken. Please, let us work together. Let us cooperate and collaborate with our health experts. And the sooner every single Kenyan begins to do that which is necessary, the sooner we shall be able to get back to normal.
Right, and Honorable Maure, you hear Ruben there raising questions about why it should be the president or the political leaders making these pronouncements, but he alludes to having consulted with the medical and health experts. But there are 2 questions that come out of the views of those 2 people that have spoken. And one, Senator Linturi raises the question of, at the start of the pandemic, there were those relief measures. Now we don't have them. Is it even a possibility that as we go through this partial lockdown, which is hurting businesses, I'm sure you know that, what then are you offering the people as a government?
I think the first item or the first question was about the relief measures. When they came, they did quite a major boost to many families and businesses and people who are really affected. It also included the free Safaricom transactions of less than 1,000 shillings, which was also dropped. As everybody is aware in this country, we have this wave which has come in a more furious and vicious way than the other two waves, and it has literally affected every corner of this country. And the main spender actually were the political rallies. And it is unfortunate that every corner of the country that hosted these big rallies, they are experiencing a rise in the cases, which was not the situation before.
Honorable More,
now,
before you carry on, do you have any evidence that those political rallies are responsible for the numbers that we are seeing? And specifically, which events would you say are responsible for which numbers?
No, I'm talking about political events. The political rallies that happened in between the last 4 months have actually 70% to blame for the wave that has come.
That's what I'm asking. What is the correlation? What is the direct connection that you can talk about?
The direct correlation, there are areas where we didn't have those cases of corona victims. I can give you an example. In my constituency, there are almost about 5-7 cases that I know the last 2 days. And the entire of last year, I cannot mention you 5 cases that happened. So it is the events that were taken there. Now, I think let's not digress from the question.
Yeah, carry on with the relief measures.
No, about the relief measures, it is Parliament which lifted them, not the President. The President gave a proposal, Parliament and the Senate would have declined to lift those measures. The reason being, at the time when we were lifting them, actually everybody thought we had flattened the curve and everything was going on well. That is one. Two, the issue of my friend, when he says...
Sorry, Honorable More, we appear like you're losing you.
I don't know why. Is it okay?
Honorable More, carry on. It appears someone is trying to call you.
No, I'm using a computer, not a phone.
Okay, just go on.
So, anyway, what I was explaining to you is that the issue of understanding what a government is, the president, the presidency, is not the individual who makes those announcements out of his own fluke. The presidency is actually the confluence of all the institutions of state. It involves all those government, the administration, the experts, whatever it is that needs to be said, people say it through the president. When he does the curfew, it is because of that issue of him having all those instruments with him. I want you to remember, we are living in very difficult times. The last time there was a pandemic of this nature was 1918. And there is nobody alive who is around to tell us how to handle it. We literally have to guess every morning as you move on. The unfortunate bit of it is we started this pandemic last year, and by now we should have been able to map out strategies of how to move on about these issues of lockdowns. Now, when you talk of lockdown, we actually, there are very few things about lockdown that are happening because people are going almost most of their businesses. If you are not in hotel business or in bar business, many other people are moving. They are free to move to their businesses. So the lockdown is not like what you are having in either France or UK, where you actually stay in the house for the period that is announced. So,
but obviously, Honorable More, obviously, you know the uniqueness of our economy, that those establishments, whether it's bar, restaurants, they employ a lot of people. Some of them may be informally employed, but then again, when all these measures are put in place, they affect them directly. But there's a question, there's a part you've said that, don't worry, Omari, I'll get to you. But first, Honorable More, you've said that we wake up every morning, we have to guess every morning what to do. Yet this pandemic has been with us for more than 365 days. That is more than 1 year. we're still guessing. And the specific question is, even as you blame Parliament for agreeing with the President or with the government, with the executive to approve the review of the relief measures, we're at such a time that, yes, we have gone again to hurt economies that were starting to recover. Is there anything that can be done practically from what you know? Do you even have the resources to support people and businesses like we did in the first time?
I think, number one, we don't have the resources. Number two, when you say you don't have the resources, it is true you don't have the resources. The one that would have cushioned them, it is not there because the taxes, the institutions or the sectors of the economy which would have been paying huge amounts of taxes are the ones that have been shut down. If you go to our CBD, it's like a shell without the major hotels like Intercontinental Hotel or the Lake Hotel, the Norfolk Hotel. Those ones, they have thousands of employees. On top of those employees, you are losing the payee. You are also losing the people who supply those hotels. And without the VAT is also coming from the services.
Right.
You literally you cannot say government should be able to come in when you know very well government does not have the money that you are talking about.
Right, and Dunstan Omari, I don't want to leave you out of this because we have all these conversations and there appears there's no sure way out of this. It's a pandemic that has really hurt many, but also mentally. Now, what do we do from where you sit?
Thank you, Sam, and viewers of Citizen TV. Happy end of Easter. What we are facing, Sam, is one of the most critical situations the country has ever found itself in. We have had COVID for the last 365 days. We have never learned any lesson. We have only learned one lesson: to put our heads deep, deep, deep in the sand. The president has addressed the nation. Everybody has seen what the president has said. The president is very clear that he consulted only doctors. The first time COVID came, the president consulted economists, central bank was in the lead, major banks were on the lead, and very many technocrats were involved. And that's why we had a package to cushion Kenyans. Why did this time the president only consult medical doctors? If the president is listening, and I'm sure some listen to Citizen TV right now, he should call for another major stakeholders to advise him on how to cushion Kenyans on the economic downturn. Number two, Sam, the type of battles that we are engaging. The battles, for example, with the British people, is it necessary? Do we have the financial muscle to put conditions on Britain? Where are the flowers going to go? Okay, they come to Nairobi.
Dunstan, Dunstan Omari, we are having challenges listening to you. We'll allow you time to restart your device so that we can get on with this. Senator Linturi, I want us to take a short break, but when we return, we'll continue this conversation, including that standoff between the UK and the Kenyan authorities over COVID-19 red listing at a time that the Kenya Airways has followed suit and suspended flights starting Friday to the UK and from the UK until all this is sorted out. So we talk about that after the break. You can text in your views to 2422 or tweet us at Citizen TV Kenya at Sam Gituku. The hashtag to use is DAYBREAK. We're back shortly.